A novel coronavirus, later designated SARS-CoV-2, emerged in Wuhan, China in late 2019. This virus, causing a respiratory illness known as COVID-19, quickly became a global concern. Its origins traced back to a live animal market, highlighting the risks of zoonotic diseases. The virus spread rapidly through human-to-human transmission. With no known cure or vaccine at the time, the world watched with apprehension as COVID-19 began its relentless march across the globe. In early 2020, the United States identified its first case of COVID-19 in Washington state. The infected individual had recently traveled from Wuhan, China. Initially, the virus spread slowly, with cases concentrated in specific geographic areas. However, the lack of widespread testing masked the true extent of the outbreak. As weeks passed, community transmission became evident, indicating that the virus was spreading undetected within the population. The situation was quickly evolving, and the United States found itself on the brink of a public health crisis. Faced with a rapidly escalating situation, the U.S. government implemented a range of measures to curb the spread of COVID-19. These measures included travel restrictions, initially targeting China and later expanding to other affected countries. Social distancing guidelines were introduced, urging people to maintain a safe distance from one another. Large gatherings were discouraged, and in some areas, banned altogether. Schools and businesses closed their doors, transitioning to remote learning and work-from-home arrangements whenever possible. The nation entered a state of lockdown, grappling with the enormity of the pandemic and its far-reaching consequences. Section 4. Public response, fear, uncertainty, and resilience. The COVID-19 pandemic elicited a complex mix of fear, uncertainty, and resilience among the American public. As the virus spread rapidly, people were gripped by a sense of dread and confusion. The sudden changes to daily life were overwhelming. The virus's novelty and the rapidly evolving information landscape fueled anxiety and confusion. Misinformation and conflicting reports made it difficult for people to know what to believe or how to act. People grappled with the invisible threat, unsure of how to protect themselves and their loved ones. Everyday activities became sources of stress, and the constant vigilance took a toll on mental health. The lockdown measures, while necessary, brought their own set of challenges, disrupting daily life and isolating people from their communities. Businesses closed, jobs were lost, and the economy took a significant hit. Amidst these difficulties, stories of human kindness and solidarity emerged. Neighbors supported each other, communities came together, and people found creative ways to stay connected despite physical distancing. Healthcare workers emerged as heroes, working tirelessly on the front lines of the pandemic. Their dedication and bravery provided a beacon of hope during dark times. Ordinary citizens volunteered their time and resources to help those in need. From delivering groceries to sewing masks, the collective effort showcased the resilience and compassion of the human spirit. Section 5. The healthcare system under siege. The COVID-19 pandemic placed an unprecedented strain on the U.S. healthcare system. Hospitals faced a surge in patients, many of whom required intensive care and ventilators. Healthcare workers found themselves stretched thin, working long hours under immense pressure. Personal protective equipment shortages became a critical issue, putting healthcare workers at risk of infection. Testing capacity lagged behind demand, making it difficult to track the virus's spread and implement effective containment measures. The pandemic exposed vulnerabilities in the U.S. healthcare system, highlighting the need for greater preparedness and resilience in the face of public health emergencies. Section 6. Defining Moments, a Timeline of Crisis. The COVID-19 pandemic was marked by a series of defining moments that shaped its course in the United States. From the eerie silence of empty city streets to the long lines at testing centers, the early days of the pandemic were filled with uncertainty and fear. In March 2020, the World Health Organization declared COVID-19 a pandemic, underscoring the global nature of the crisis. This announcement sent shockwaves around the world, leading to widespread lockdowns and travel restrictions. Shortly thereafter, the United States declared a national emergency, freeing up resources and enabling a coordinated federal response. This move was crucial in mobilizing the nation's healthcare system and providing much-needed support to states and local governments. As the pandemic wore on, the death toll mounted. becoming a grim reminder of the virus's devastating impact. Hospitals were overrun, and healthcare workers faced unprecedented challenges as they battled to save lives. Social unrest erupted during the summer of 2020, sparked by the death of George Floyd and fueled by the pandemic's disproportionate impact on communities of color. Protests swept across the nation, highlighting deep-seated issues of racial inequality and injustice. The development and rollout of vaccines in late 2020 and early 2021 offered a glimmer of hope, signaling a potential turning point in the pandemic. Vaccination clinics were set up across the country, and people eagerly lined up to receive their shots, hoping for a return to normalcy. Section 7. The pandemic's enduring legacy. The COVID-19 pandemic left an enduring legacy on the United States, profoundly impacting every aspect of American life. From the way we work and learn to how we interact with each other, the pandemic has reshaped our daily routines and societal norms. The pandemic exposed and exacerbated existing social and economic inequalities. Vulnerable communities were hit the hardest, revealing the deep-seated disparities in access to healthcare, employment, and essential services. It highlighted the importance of public health infrastructure and the need for greater investment in pandemic preparedness. The tireless efforts of healthcare workers and the rapid development of vaccines showcase the critical role of science and innovation in combating global health crises. The pandemic also underscored the interconnectedness of the world, demonstrating how a health crisis in one part of the globe can quickly escalate into a global challenge. International cooperation and